Good afternoon, everyone. I'm going to give everyone just a minute or two to get started. And while we're waiting, I'm going to go quickly through some webinar housekeeping notes. First and foremost, for all of you joining, this session will be recorded and shared after over email. So if you miss part of the session, if you have a coworker who's unable to join, you can share the recording with them. Secondly, all attendees will be on mute for the duration of the session, but we do have a Q&A panel on the bottom and some dedicated Q&A time at the end. So if you have any questions, please submit them to us. Finally, this session should wrap up in about 45 minutes. We're really excited to be chatting with you all here today, and I'm going to pass things over to Sophia to kick us off.
Thank you. So welcome everyone to our webinar on how you can uplevel your credentialing, hearing insights on reducing costs and driving profit from industry experts. So I'm Sophia, Senior Product Marketing Manager here at Bullhorn, focused on the healthcare vertical. I have with me Chris Lewis, who is our Senior Solution Consultant, also here at Bullhorn, and then Latisha Turner from our network, and also Cecilia Merrill, who I'm just going to call Cece, has graciously agreed to join myself and Chris on this webinar to share some insights on credentialing. So what we're going to cover today is really quickly, I'll introduce managing credentials with Bullhorn Healthcare. Chris will go through a short demo, and then the majority of the time is going to be a panel of Latisha and Cece sharing different insights on credentialing at CrossMed and our network. So managing credentials with Bullhorn Healthcare, it's all about clearing providers for work faster. And how we do that is we have self-service credentialing that's tied to the Bullhorn ATS. So as a provider, you upload your credentials, update it, it flows there. Your credential specialists, they are able to get visibility of the compliance status of your entire workforce, knowing who needs to be credentialed, what steps do they need to take, and then it's in that centralized location that they can store and share those credentials. And then in order to make sure that folks remain compliant on the job or ready for redeployment, we have those automated expiration alerts that you can send to providers as well as to your internal team to follow up. And now I'm going to hand things off to Chris, who will show you what this looks like.
Perfect. Thank you, Sophia. If you wouldn't mind, I'll go ahead and jump in and start sharing. Perfect. All righty, yes. So thank you for that, Sophia. And as we jump in and look at credential management here with Bullhorn Healthcare's solution, we're going to be looking at a couple different places of really the credential workflow of how we're going to be able to leverage Bullhorn to automatically have the credential flow from the facility level down into the job order and then eventually to the assignment, and then having and leveraging Bullhorn's talent platform and automatic credential request to be able to go out and ask the provider for the credentials that are needed, driving those automatic notifications and reminders, whether it's to complete the credential to make sure we're able to have them start on time, as well as when we think about ongoing compliance when it comes to notifications and reminders and management of the upcoming expiration credentials and those that may have already been expired, and getting those in compliance, and the ways that we're going to be able to drive the provider to be able to do some self-servicing. And then from there, we're really going to jump into looking at the new compliance manager dashboard and how it's really going to be that one-stop spot for all of your compliance specialists, and then ways that we're going to be able to manage our assignment requirement compliance. So here's, we jump right on into Bullhorn and we look at that automatic credential flow. So here, as we look at BJC Hospital and we think about being able to come in and set facility level requirements to be able to have that then carry into the job orders and the assignment. I'm going to be able to come in and easily right within the facility itself and create my credential requirements or my requirement groups right here at this level. So we've created a group that has an encompassing of a couple different credentials that are going to be required for any job order that we're creating for this particular facility. So we have that group that's been assigned. So gone are the days of having to go through and kind of track down as we're creating the job, or we begin to match the provider to that assignment to figure out what certifications, the credentialing, licensing we're going to need. We're going to be able to set that right here at the facility level, then allow that to start driving then into the job level as well. Now, not only do we have that automated flow down from the facility to the job, but now we're also going to be able to come in if there's additional requirements, maybe based off of the category of the role, the specialties and such, or the department that they're going to be working in within that particular facility. We're going to have the ability to easily come in and make those adjustments as well. Bullhorn is driving continued investment around that to help with that automation process. So there's going to be more to come in the future when it comes to the ways that we're going to be able to advance and improve that credential flow. And then most importantly, where it's really going to come full fruition is going to be at the assignment level. So as we come in and we can see that we have identified Linda Green as being a great potential match here for this role and being the right fit. We're able to then associate Linda into that job, creating the assignment. Now we've got our credential status right here at the very top to bring this right to the forefront, as well as our credential requirement overview. So what this is going to allow is not only from a recruiter standpoint to be able to see, well, where is Linda at within the credential requirement workflow, but then also what has been completed, what's expired or expiring. And then we can easily come in and just by clicking into one of those categories, be able to quickly and draw back a filter of that credential management view to see, well, what is still needing to be completed? What needs to be reviewed? So we've got that quick drill in as we think about the way that those requirements are going to flow downstream. But then most importantly, when we think about, well, what are some of the requirements that may still be outstanding and the ways that we can go and start collecting that information or driving notification to the candidate around what needs to be completed, as well as, if they have any credentials that have expired. And that's really where we're going to be able to start leveraging Bullhorn's automation to be able to drive that information to our candidates as well. So when we kind of shift perspectives here and think of it from Linda Green's view, everyone's got their phones in hand, and that's really going to be the focus. We can see that we've got that quick notification right here for Linda. We can drive in and see that branded notification letting me know, hey, you have some credentials that are expired, or perhaps this is the initial request notification through that automation saying, hey, we've got some credentials that need to be completed. Now we can have Linda go right into Bullhorn's talent platform and be able to access that information and be able to provide either the new credential or update the expiring credential. So as we come in and we can see here that one of the credentials that we're needing is the vaccination checklist. So now Linda can come in and easily update that credential. I can say, yes, let's choose a file. I can come in and pull the documents that I know that I've got here on my phone, as well as I have the ability to be able to come in and perhaps I just have the document right in front of me. I can easily say, hey, let's use the camera on my mobile device or my tablet and snap a quick photo of that document. So it's really going to put the convenience right there in the hands of the provider to be able to easily update that information. But going beyond just that checklist, we also have the ability to come in and self-service any existing credentials that we may have already completed, such as, we've got an ACLS that might be coming up for expiration, and I want to capture a quick update of my ACLS that I've completed, or change the expiration date and associate the new document. I'm going to be able to come in as a provider and be able to self-service that here as well. And then as the provider is completing that information, all of that data is then going to go right back into Bullhorn, into the candidate's compliance and credentialing tab, as well as into the view for our compliance specialist. And that's where they're primarily going to be working out of, is right here in the compliance manager. Now, of course, within the compliance manager, I, as the compliance specialist, can easily come in, have my saved searches or recents that I've completed. Maybe I want to be able to filter down by the start date of the assignment or by particular status or a particular candidate. I can easily build that quick search here, but it's just as well as the familiarity you have with all of the list views in Bullhorn. I can easily come in right here from the header as well and be able to come in and create my sorts and my filters to be able to find exactly what I'm wanting to work on and be able to prioritize that work effectively. So today we're going to focus in on that assignment here for Linda Green. Now you'll notice that I'll be able to easily just click on that edit pencil, and it's a little bit different than maybe some of the other list views in Bullhorn that you're familiar with the binocular view. And the reason why we did the edit pencil, because we're not only just wanting you to be able to have visibility into the information, but also to be able to come in and make those edits and those changes to keep things up to date. So as we see here, our vaccination checklist that Linda's just completed has automatically updated to, hey, so we have a credential that's ready for your review. So as we expand that out, we now have all the information that's been able to pull over from the talent platform. We can see the image. I can click on the binocular view and be able to come in and view the image that Linda has sent over. And if there's any other information that I need to update here, such as the issuing authority, maybe it's a license that we're tracking, when was the certification issued? Is there an expiration date? Knowing that I want to be able to track these each year, wanting to make sure that everything is up to date, I can set that expiration date and then go ahead and save that information. And then most importantly is what I just quickly overviewed is being able to come in and set this as a completed or a current credential against that requirement. So now as we come through and we're able to mark that as current, we can now see that we're being able to come right here into the compliance manager. We're seeing how that information is now updated automatically, driving in those new status and updates right here within that view for us. So we've got a couple that are still out for review. Of course, we've got one that Linda still needs to complete. So as we're looking through those, hey, we're approaching that start date, and we want to make sure we're getting everything in place for Linda. Maybe I'm giving Linda a quick call because the automated emails and texts, right, we're still having to kind of chase that down. I can easily then come in and add a note right here within the compliance manager saying, hey, I called, left a voicemail regarding the CPN. And then I can come through and select and say, you know what, we're going to make sure that we're associating that to specifically the CPN as we've received everything else. And now I'm referencing this to the assignment, to Linda herself, to the job order, and then explicitly to that requirement as well. And maybe I want to set a follow-up task or create an appointment to reach out and follow back up with Linda again later today or tomorrow to make sure that we are able to get Linda started on time. So now I can come in and save that note, and all of that's going to be visible right here within the compliance manager. So when we start thinking about ways like that, the teams are able to collaborate better together, we've got not only to see what the assignment requirements are, what credentials do we already have for that provider, as well as any notes around the compliance process, all being tracked right here inside of Bullhorn. Sophia?
Awesome, thanks. Do you mind stopping sharing your screen? Thank you. Okay, great. And that's going to be a great lead in to now our panel with Cece from CrossMed and Latisha at RN Network. So I'm going to transition here. So Latisha, why don't we start with you first? Share a little bit about your role and what kind of healthcare staffing does our network do, a CHG company?
Hello, everyone. I am Latisha. I am a credentialing director at RNN. Our areas that we staff, it's primarily nursing. So that's the area that we focus in on mainly. I am responsible for the credentialing team, and with that team, we manage our providers starting their assignments, and our goal there is to have them start timely.
And how about you, Cece? Share a little bit more about your role, what you do at CrossMed, and what kinds of healthcare staffing does CrossMed do?
Sure. Like Sophia said, I'm Cecilia Merrill. I'm the Director of Operations at CrossMed. I have been in staffing for about 7.5 years now. Originally on the sales side, so now being on the operations side, just getting a little bit more insight on that side. I currently oversee our credentialing department. We staff and credential allied and nursing professionals. And like Latisha, our main goal is to be compliant and start our travelers on time.
And, Cece, like, what is your credentialing team? Like, how many people? And like, if there's any additional information that you can provide on your credentialing team, that would be great.
Yeah, we have a manager over in our credentialing department, and then we have 8 people on the team. So they run an efficient team over there.
And how about you, Latisha?
So on our team, it's a little bigger than with CC. I am one of the credentialing directors along with my leader. She is our senior director, and we have several credentialing managers, and I would say a little or more than 30 people on our team.
Oh, that's a lot. And I know you both touched on the goals around staying in compliant. Any other kind of goals of your credentialing teams that either of you would like to share before we start to go into the next part?
I think the biggest goal is we want to make sure that we minimize cancellations and again have on-time starts along with compliance. Compliance is a big piece, so we want to make sure we are staffing our facilities with people who are competent and will do a good job when they get there.
Anything that you'd like to add, Cece?
Yeah, a lot of our answers will be the same. I would say additionally, we like to just be that liaison for the sales staff. So we like to be able to help them through this process with their travelers because they're the ones talking to their travelers and their clients. So anything that we can do to support them on the back end is what we're here to do.
Awesome. And so Latisha, I know that you've been at our network for a while. So what was your credentialing processes like? What were they like before you decided to move those processes over to Bullhorn?
I think back then we had a lot of providers faxing documents over to us. I think that's where credentialing has evolved, where back then we had faxing, we had more emails. So I think that's where some of the challenges came in, where you could not, the provider sent it to this number, to this person, and there was inconsistency in terms of where things are. So I think that's where it all started, having things in multiple places.
Sounds messy. And then Cece, I know that you're newer to CrossMed, and you came over from the sales side. So what was like credentialing like for you and past roles at other companies, and how have you seen credentialing evolve since joining CrossMed?
In the past, it was a lot of spreadsheets. So it seemed like you could only get updates from one person. And it's evolved tremendously. So being able to house everything in Bullhorn, CrossMed on the tech side is really just put a focus on that. So the credentialing side inside of Bullhorn where sales can view it. If there's someone out on the credentialing team and someone needs to cover it, just makes it easy to see where each traveler is at in the process. Credentialing was already established when I began here at CrossMed, but since then we've just really tried to take it to the next level, really match our side in Bullhorn to what the vendors are needing, to what the clients are needing. So we just have a true insight of what does that traveler exactly need to be compliant.
And I know how hard it is to keep track and to keep spreadsheets updated. It's not an easy task.
Yes.
And then, so now we're going to transition more to the solution. So we have Compliance Manager. That is the latest credentialing capability that we have released. And Cece, like from your experience and what you've seen just during the beta, how does Compliance Manager support your credential processes and your ability to be compliant for your credential teams?
It centralizes everything, which is like key. So the team, they've told me that they love being able to see everything in one spot. As Christopher showed us earlier on the demo, that little toolbar of when it turns green of someone being fully compliant to not, that tracking just helps the team kind of begin their day. So the compliance manager, they can pull it up, they can have their save search to their desk of who they're trying to get compliant, and then kind of prioritize their travelers in their week based on, who needs the most stuff, who's already compliant that they have cleared. It's just made it in one spot for us internally. And then I think too, externally for travelers, we're asking them to go to the same portal for updating their profile information, for updating their credentials. Hey, did you just get the flu vaccine? Go out there and upload that documentation. So it just kind of prompts them. We know that they work odd hours as well. So if they're able to just jump on and complete things and upload things, even if we're not available or if we're not at the office, it's super helpful for them as well.
Yeah, and healthcare is 24/7.
Yes.
People need care at all hours of the day. So that's really convenient for them.
Absolutely.
How about you, Latisha? Like, what has been your experience seeing compliance manager rolled out at RN Network? And what's been the experience of your teams using that functionality?
I think it's great. It's similar to what CC says. It's centralized. So from a leader standpoint, you can see what's going on in terms of where each person is. It's a snapshot of the credentialing process in terms of where they're at, what's still missing. As CC said, it's so centralized. Even from a provider standpoint, it offers a better experience because they have access 24/7 to log in. I think the other piece is you can match everything so you log in, you're in the compliance manager from start, and you're able to match everything from there without having to go to multiple places. So I think overall great, very user-friendly, centralized, easily accessible. I think those things are great attributes of what the system offers.
That's awesome. And then Cece, we talked a little bit about this, but how are you thinking about like automating your credentialing process?
That's what I would say we're tackling next is automation. So sending out expiring reminders 30, 60, 90 days out, being able to automate that piece of when something expires based on that date that's entered into Bullhorn on the credential. That I think is our most exciting piece that we're going to tackle once we're ready to do it. And then anything else that we can do to automate any touch points, we're going to work on that as well.
I mean, one thing at a time, right? You don't want to boil the ocean. So
yes.
That's exciting to hear. And then for Latisha, what have you seen on the impact on your credentialing team by streamlining the credentialing process?
I think overall it's great for the team because then they have information that's easily accessible for them. They know where to check for documents, so they know they can have access to the information that's in the portal. If they do have a requirement, they can send it to that provider through the portal as well, where they can obtain an electronic signature. So it's just easier in terms of managing day to day, having that central spot where you can look for your requirements. So you're not going into multiple places. So I think overall it's just a great experience for them, knowing where they can find information and send information as well.
Anything that you'd like to add, Cece, or in terms of the impact on your credentialing teams and their experience?
Yeah, I think there's just a lot of features that keep coming out, which is awesome. That makes them excited to use the tool. Another favorite of the team is just being able to see their pending assignments. And then when their document comes in that's pending review, they're able to quickly see which candidate has put documents out there. They can quickly review it and verify it instead of having to go into each assignment. So anything that makes it just a little bit quicker, a couple less clicks is very helpful.
I mean, and I know it sounds small, but when you take a couple of clicks and you multiply it by 50, 100 candidates, that adds up.
Absolutely.
And then, Cece, from your experience, how has, streamlining this credentialing process for your providers impact the provider experience with CrossMed?
I think it's just that one spot to go for all of their information. I think we keep repeating that, but being able to just make it simple of they see their list of tasks, they can upload what they need to do. If they renew any type of certification or credential, they're able to just go out there and immediately upload it. I think that helps us too from the traveler. They're just uploading it, so they're not having to send it to their recruiter and to the credentialing specialist, and then multiple people. They can just put it in one spot and we all have access to what we need on the inside.
And then Latisha, is there anything that you want to add on top of that?
I think from a provider standpoint, not having to go to multiple places, like going somewhere to fax something. I mean, I think that's a huge win. They can take a picture real quick and upload it to the portal, because again, that's the last thing a traveler wants to do, to be spending time going multiple places. So I think just the accessibility is great for them, and again, they can access at any time. So I think that piece has helped them tremendously, because there is no need to be faxing or having to upload it at a specific time when they can be proactive and do it early.
Yeah, I don't even know where I would find a fax machine today, but I know exactly where my cell phone is right now. So and then lastly, just for the impact, like Latisha, what would you say has been the impact on client relationships by improving your credentialing process?
I think overall, again, I think I'd go back to, having that electronic signature. Even if it's something at the last minute, you can get it to them quickly versus waiting for someone to get to somewhere. I think overall, it's just great, just knowing ahead who you have to start, where they are, and just having that centralized spot where you can grab information.
And how about you, Latisha? Have you seen any impact on client relationships, and what has that been like? Oh, not Latisha, sorry.
I think
Cece.
Cece.
You're fine. Yeah, we've seen a ton of our scorecard grades, I guess you could say, have gone up. Back in April, we were at about a 79% cleared rate. And as of September, we were at 91%. So we've just cleared a lot more people on time by using the credentialing in Bullhorn and being able to get our travelers to the clients a lot quicker and on time of when we originally said that they could be there.
That is amazing. That's really awesome. And then last question from me, and then we'll open it up to the audience for any of us to answer. So Latisha, like, what advice would you give folks looking to improve their credentialing process? Just anything.
I think just being open to the change, because I know it's very comforting when you're doing things the same way over time. I mean, I've been in credentialing for 20 years plus, and I've seen the evolution of credentialing. So I think just being open to a change, being open to explore what some other options are, I think that's definitely an area to consider.
And how about you, Cece? Like, what advice would you offer to anyone looking to uplevel their credentialing?
It's the change, and then it's adapting to it. So if you're going to do it, you just have to commit to it. And I think it doesn't have to be a huge thing at first. I think you can take it step by step, of just the little things that you implement, and then gradually add on as the technology develops. We also do a lot of looking at different vendors that are able to integrate into Bullhorn, so that we can keep internally our people inside of the system, inside of Bullhorn, and so they're not having to go outside of that a lot, which I think also helps kind of streamline things and improve things. So I think you can always start small.
I think that is a very, very good life advice in general. Start small, start somewhere.
Yeah.
Going. Well, thank you both for answering and all these different questions and being a part of our panel. I'd like to open it to the audience, and folks, like, please drop in your questions. We have, Chris here, Latisha, Cece, myself, if I can answer any questions, but open and curious to hear what people have questions about.
I can jump in and start asking some questions for you all to answer. First of all, I think, Latisha, this might be a good one for you. How did you roll out this new technology to your teams and ensure good adoption?
For us, it's in phases. I think Cece even mentioned it, like just doing small pieces of it, because change is never easy. I mean, it's hard to adapt to that change. So I think just doing it in small phases and maybe explaining the why behind that change.
Great, thank you, Latisha. This one I'm going to hand over to Cece. Can you explain a bit how this has increased collaboration between your recruiters and your credential specialists?
Yeah, internally our team is able to work at a high level together. So I think the big thing is they're starting to speak the same language. So recruiters are getting more comfortable with steering their travelers to the right portal of where they can do all of their credentialing pieces. And then we all are in the office, which is helpful, but I know that's not always the case, but they work together in communicating, what things are still needed. What does the traveler still need to do, taking phone calls as well. So I think it all being in Bullhorn and having the same view and being able to view those credentials has helped just the recruiters be able to speak to what we need, as well as the credentialing specialists being able to provide real-time updates of what is still needed.
Thanks.
Using the same language is really important. It's hard if you don't.
Yes.
Chris, I have a question for you, if you don't mind jumping in. A question on the product side. Is Compliance Manager only available with Bullhorn Healthcare Edition?
Yeah, so the Compliance Manager, as long as you're within Bullhorn Enterprise Edition or Healthcare, you are able to get that enabled. Typically, it's just an easy process to have a conversation with your account manager, or have one of your account or support contacts submit a ticket into support. They'll validate that you meet the eligibility requirements, and they'll work with you to get it enabled.
Great, thank you, Chris. So if you want to jump in and help me look through, there's so many good questions coming.
Yeah, I think kind of related to the cost. So like Chris said, it is included in the ATS and CRM Enterprise Edition, which means it's also part of Bullhorn One, Bullhorn Healthcare Enterprise Edition, other bundles that we have. For implementation, there is no implementation cost. But we do recommend that you go through professional services or an SI partner in order to make sure it's set up correctly. Since it is important to make sure that you have all of your credentials tied to the placement in order to use Compliance Manager. So I will say that professional services and SI partners to help implement does come with a cost, but you don't necessarily need that, even though we highly recommend it.
Fantastic. We have a couple people raising their hands. Do you mind if I hand it over to them to ask some questions out loud?
Sure, I didn't even realize that was something we can do on our webinars.
Terrence, I'm going to hand it over to you. And
it looks like as if Terrence is still muted.
I am. Terrence, if you're able to answer a question, you can unmute yourself and ask. If not, we can keep going through the Q&A in the chat.
I see Marie has unmuted, so maybe she has a question.
I do. And just FYI, I don't see the normal way of muting and unmuting ourselves. Somebody just threw up a banner. So, and I said, unmute.
Thank you, Marie, for letting us know.
Yeah. So is there any plans for this not to be tied strictly to the placement? We have users who are very much in, they would love to see the Compliance Manager. They do not submit to placements until such time as they've at least passed the basics. And to be able to have a Compliance Manager that goes from soup to nuts would be awesome. They use credentialing They use it at the submission level. We were having to develop columns for them, custom columns that then are having to be manually updated. So any plans to bring this out of just the placement to include the submission?
Not currently, Marie, but I can take that as feedback from our product team. We really value hearing from our customers. And so I can make sure to bring that back as feedback for our team to consider.
Thank you.
Thanks, Marie. Another one for Chris. Is there a way to generate a compliance packet out of the docs uploaded with a template or something similar?
So yeah, so while there's not a compliance packet inside of the talent platform or onboarding that's being created, you do have the capability to then, once you've created and collected the credentials inside of Bullhorn at the provider level, to be able to use our Stitch PDF functionality to be able to join those credentials and attachments into a singular file. So if you think about, whether you have a facility that you're needing to submit those attachments back to for verification, or most specifically, we hear this a lot when it comes to VMS end clients, right? Leveraging an MSP or a VMS, where you're having to submit a copy of the credentials with that submission, instead of having all of 35 different attachments, you're able to stitch those into one singular PDF.
Thanks, Chris. I also wondered if you could jump in. I know you typed out an answer to this, but someone asked a question, Courtney, about 30, 60, 90-day reports for expirations, and you gave some insight on how to use Bullhorn automation. I also feel like that ties in well to Cece, who's going to be implementing automation. So I was wondering if you could talk through that once again.
Yeah, absolutely. So when we think about the ways that we're able to report on and drive actions around expired or expiring credentials, one of the best practices we see a lot of our healthcare customers leveraging is Bullhorn automation, where not only can you create external notifications, whether that's through email or texting with Bullhorn messaging, to your providers to let them know, hey, we've got credentials that are coming up for expiration at 90 days, 60 days, 30 days. You could break it down into 2 weeks or weekly at that point. So your automation administrators would be in control of what that cadence would look like. So it gives you extreme flexibility in that, but also be able to drive internal notifications to your compliance teams, to the candidate owner, to your recruiter of, hey, we're needing to reach out. We're haven't got much response yet from this candidate. Maybe you want to reach out as well, being that you have apply a better relationship with them or a deeper relationship with them than we currently do at this moment, to then be driving that information as well internally around expired or expiring credentials. And then, of course, being that the credential expiration and requirement expiration dates are captured inside of Bullhorn at the candidate credential level, you can leverage Bullhorn reporting to also generate reports based on that information.
Thank you so much. Another question about maybe a roadmap item. So this would maybe be for Sophia or Chris. Are there any plans to provide a client view of provider credentials to include a process of sharing the data or image in a secure manner?
Not at this time.
Like once you get these, like you said, Sophia, it's great to have ideas to bring back to our product team.
Yes. Sorry, I'm going through some of the questions here. How many files providers? So I have one from Lindsay. How many files providers can your teams carry and work at one time with this automation in place? So I don't know, Cece, Latisha, I think it's really more around like the streamlining credentialing process. Like, what is the load that you found that your teams can carry with having this so streamlined and centralized? If either one would like to take the question.
Yeah, I think we're still working on how many that is. Based on, our growth and how many travelers that we have out there. We have seen efficiencies though, in the way that they're able to track their desks and manage their desks, that they're able to do it at a higher level than in the past. So I would say we're still in the works of what that magic number is, or how many they can actually run.
Like you said earlier, start small and you gotta start somewhere and.
Right.
I think it's the same for us, still trying to figure out that number.
Makes sense. I mean, healthcare things are always changing and there's new technologies, which kind of changes the equation a little bit. So, let's see, maybe we can have one more question. I'm trying to, it's a little hard to go through questions and ask at the same time. Chris, this might be a good one for you. Is the credential portal separate from the time submission module for providers?
I'm sorry, come again with that, Sophia?
So for providers, the talent experience, is the credential portal separate from the time submission module?
So I guess my follow-on question that would be dependent upon what time submission module they're leveraging or referencing to. With Bullhorn's talent platform from a product development standpoint, we are working with integrating. Currently, we have a single sign-on experience for our talent inside the talent platform to Bullhorn Time and Expense. So if you're leveraging like the Bullhorn Healthcare, Bullhorn One edition of that with time collection, we do have that available for your candidates or providers today. We are also looking to then take that beyond the SSO and actually having that embedded into the talent platform, where it wouldn't be a redirect, it'd be living natively in there as well from a time collection standpoint. We do have the ability with talent platform to iframe in external marketplace partners, so going beyond a time collection partner. But when we start thinking about maybe a skill assessment partner, background screening, drug screening partner, to have those integrated into the talent platform as well. So we're really creating that all-inclusive place for your talents experience.
It's like Cece said earlier, that one-stop shop for providers. Awesome. Well, thanks so much everyone for joining us today. Special thank you to you, Cece and Latisha, sharing insights on what credentialing has been like at CrossMed and our network. And thank you as well, Chris. So thank you, everyone. I hope you all have a great rest of your day.
Thank you.
Thank you.